Hello. I hope everyone is having a beautiful day. I'm Dr. Stefan, and today we will be talking about beetroot juice for circulation and blood pressure, how it may work, who might benefit, who should be cautious, and the simplest way to use it safely at home. As always, this channel is educational. It doesn't replace your personal clinician. If you're on blood pressure medicines or diuretics, or you've had kidney stones, please check in with your healthcare team before you start. Let's make this calm, practical, and evidence-aware. Grab a glass of water, settle in, and let's begin. First, a simple map of what's going on in your body. Beets are naturally rich in inorganic nitrate. After you drink beetroot juice, nitrate gets absorbed into your blood, concentrated in your saliva. And this is the elegant part: your oral bacteria convert nitrate into nitrite. You swallow that nitrite, and your body can turn it into nitric oxide, or nitrogen monoxide for short. Why do we care about nitric oxide? Because no signals your blood vessels to relax. That relaxation, what we call vasodilation, helps the vessel walls become a little more flexible, which can gently lower blood pressure and support healthy circulation. 2 tips right away. Protect the pathway. Very strong antibacterial mouthwash can temporarily reduce the helpful bacteria in your mouth and blunt this nitrate to nitrite step. You can still brush and floss like a champion. Just avoid antibacterial mouthwash right around the time you take your beet juice. Oral health matters. A healthy mouth sets you up for better results. Think of your tongue as part of your circulation toolkit today. So, beetroot juice gives nitrate, gives oral bacteria, gives nitrite, gives nitric oxide, gives gentler, more relaxed arteries. That's the core idea. Who might benefit most? People with elevated blood pressure or hypertension who are working on lifestyle changes, cleaner plates, more walking, better sleep, a calmer daily rhythm. Beetroot juice is not a magic bullet, but it's a useful lever that pairs well with other good habits. You might also notice benefits if your circulation feels sluggish, cool hands and feet, slow warm-up during exercise, or afternoon stiffness. A little more nitric oxide can be a friend there. Now, who should be cautious? Kidney stones, especially calcium oxalate stones. Beetroot juice is high in oxalates. That doesn't mean you can never use. It does mean talk to your clinician or dietitian first and keep the rest of your day's oxalate load in mind. Hydration and getting enough dietary calcium with meals are standard stone prevention strategies. On antihypertensives or diuretics, or you run low blood pressure already, beetroot juice can add to those effects. That can be helpful or too much, depending on your situation. Coordinate and measure. Pregnancy, breastfeeding, or chronic kidney disease. We individualize here. Ask your clinician first. Beeturia, red or pink urine or stool after beets, is common and benign. It can be surprising the first time, so I want you to know in advance. It's okay. Remember, food first tools like beet juice are adjuncts. We don't stop a prescribed medicine because we re-drinking a vegetable. Any changes to medications are a team decision with your clinician. What does the research say in simple words? When scientists combine clinical trials in hypertensive adults, beetroot juice tends to produce a modest reduction in systolic blood pressure, and sometimes a small dip in diastolic as well. The benefit is more consistent when the juice contains enough nitrate. I'll give you numbers in a moment. It's used regularly for weeks, and it's paired with smart basics: walking, fiber, and attention to sodium. No single number fits everyone. But the effective nitrate window in many studies lands roughly between approximately 200 and 800 milligrams nitrate per day. Classic trials used about 250 milliliters of nitrate-replete beetroot juice, often delivering around approximately 6 mol of nitrate, roughly 370 milligrams. Some commercial shots use approximately 70 milliliters to deliver approximately 400 milligrams nitrate in a smaller volume. The exact nitrate content can vary by beet variety and processing. So think in ranges, not absolutes. 2 take-homes. Expect gentle, not dramatic changes. Think in weeks to months, not days. Let's talk practical. Prep at home. If you juice 1 medium beet, you'll typically end up with 200 to 300 milliliters of juice after you pass it through your juicer. Yields vary, beets aren't identical, and juicers differ, so don't worry if your volume is a little more or less. If the flavor is earthy or intense, you can blend with a splash of water or a little carrot or apple. Try to keep added sugar low overall. Serving guidance. A realistic starting serving for blood pressure goals is approximately 250 to 300 milliliters of beetroot juice, or approximately 70 milliliters standardized nitrate shot. If you're using homemade juice and you don't know the nitrate content, just be consistent with volume and timing, then read your blood pressure log to see how your body responds. Storage. Keep juice refrigerated. Use within 48 to 72 hours for best quality. A small squeeze of lemon can help preserve color and freshness. More importantly, avoid leaving juice out at room temperature. Mouthwash reminder. On beet juice days, skip antibacterial mouthwash around your serving time. Brush and floss as usual. One of my favorite habit stacks is this. Drink your beet juice. Set a quick timer for 10 to 20 minutes and take a gentle walk. Does beet juice require a walk? No. But nitric oxide supports vasodilation, and easy movement helps your vascular system take advantage of that open window. You'll also get stress relief, which matters for blood pressure all by itself. If walking outdoors isn't an option, try slow marching in place, easy cycling on a stationary bike, or a few laps up and down your hallway. We're aiming for circulation, not exhaustion. Let's build a simple plan. You can screenshot or jot this down. Week 1, find your footing dose. 250 milliliters beetroot juice 3 days this week, for example. Monday, Wednesday, Friday. Mouth. Skip antibacterial mouthwash around those servings. Measure. On those days, check your blood pressure about 2 hours after you drink, and again the next morning. Log. On 3 to 4 days this week total. Take 2 readings each time, 1 minute apart, seated, cuff at heart level. Record both numbers and a quick note: beet juice today. Salty dinner. Walked 15-minute. Week 2, build the routine. If you felt good in week 1, repeat the 3 per week pattern, or move to every other day. Keep the BP log going. Consistency beats perfection. Week 3, decide your rhythm. If your trend looks favorable and you're tolerating it well, you can consider daily use within that approximately 200 to 800 milligrams nitrate day idea. If you prefer to stay at 3 to 5 days per week, that's okay, be consistent. Week 4, review and personalize. Look at your month of readings. Do you see a gentle downward drift? Are mornings smoother? Evenings calmer? Share your log with your clinician if you're on medications. Beet juice is a helper, and helpers work best in a coordinated plan. Hydration and timing tips. If you're sensitive to nighttime bathroom trips, take your serving earlier in the day. If you're stone prone, hydrate well and discuss your total oxalate pattern with a clinician or dietitian. Let's keep this safe and comfortable. Oxalates and stones. If you've had calcium oxalate stones, pause and talk to your clinician. If you proceed, focus on hydration and meet your daily calcium needs with meals to help bind oxalate in the gut. Keep your overall oxalate exposure in check the rest of the day. Additive hypotension. If you're on antihypertensives or diuretics, beetroot juice can nudge your blood pressure further down. That might be desirable, but measure to be sure. If you feel lightheaded, sit, hydrate, and scale back. Beeturia. Red or pink urine or stool after beets is common and harmless. It's a color story, not a danger sign. Taste and stomach. If the flavor is earthy, add a squeeze of lemon or blend with carrot. If your stomach is sensitive, try smaller servings or drink with food. Oral microbiome. Remember, no antibacterial mouthwash around your serving. Normal brushing and flossing are great. Red flags. Severe headache, chest pain, shortness of breath, or neurological symptoms are medical issues. Seek care right away. Beet juice is not the cause of emergencies. Don't let a home remedy delay urgent help. Here's a home method that respects flavor, safety, and your time. Wash the beet thoroughly. If it's very dirty, peel it. Otherwise, a good scrub is fine. Juice it. If your beet is small, juice 1.5. Aim for approximately 250 to 300 milliliters total liquid. Add a splash of water if needed. Optional lemon, a small squeeze brightens flavor and supports freshness. Refrigerate promptly if you're not drinking it right away. Use within 48 to 72 hours. Rinse your mouth with plain water afterward if you like, but skip the antibacterial mouthwash near your serving time. Walk for 10 to 20 minutes if possible. Measure your BP at the 2-hour mark, seated, back supported, feet flat. Take 2 readings and note them in your log. That's it. Simple, repeatable, and easy to fit into a real life. A few myths to clear. Natural means unlimited, not quite. We aim for reasonable servings used consistently, not megadoses. It replaces my medication. No, it's a companion habit. Any medication changes happen with your clinician, guided by your log. If I don't see big changes in 3 days, it doesn't work. Blood pressure is pattern-based. You're looking for a trend over weeks. Add walking, mind your sodium, and protect your sleep. These levers add up. Your mindset matters. Treat beetroot juice like self-respect and a glass of small daily vote for your heart, your arteries, and your future. Today we explored how dietary nitrate from beetroot can become nitric oxide and gently relax blood vessels. Who's likely to benefit? And who should be cautious, especially anyone with kidney stone history or people taking blood pressure medications? We covered a practical protocol. Start with approximately 250 milliliters of beetroot juice 3 times per week. Avoid antibacterial mouthwash around your serving. Track your numbers 2 hours after and the next morning, and build from there if you tolerate it well. If this was helpful, I'd love for you to share it with someone who might benefit. And if you try this, come back in a month and tell us what your log looks like. Your experience helps the whole community. I'm Dr. Stefan. Be kind to yourself this week, move your body gently, eat colorfully, and I'll see you in the next episode. Take good care.